Hello and welcome to NewsFirst Prime. This is Archana Ravi Kumar. Pregnancy itself is a beautiful journey, but along with pregnancy comes in a lot of questions too and a lot of confusions too, from the old wife tales to the modern internet myths. In today's episode, we'll just break down about some misconceptions and confusions about pregnancy. To answer our queries, we have with us Dr. Thejaswini, who is a gynecologist in Motherhood Hospital, Electronic City. Doctor, welcome to our show. First things first, like any woman who gets pregnant, especially the first time, they'll have way too many doubts, especially during food and what to eat and what not to eat and all that. So what would you say, doctor? Like, is it once they have a baby in their womb, do they have to eat for two people, or is eating for one sufficient enough?
See, in the first trimester, actually extra calories are not required. And then along with that patient having a lot of nausea, vomiting, I mean, she's as it is, she'll not be able to eat so much. Okay. In the second trimester, extra around like 250 to 300 calories is enough. And in the third trimester, extra 450 calories is enough. Okay. So strictly speaking, eating for two people is not right, in fact, because excessive weight gain can predispose you to gestational diabetes and all that. So it is always better to have a balanced meal. You should always concentrate more on quality than the quantity of the food. Make sure that in your food everything is included, like fibers, that is, which is given more by vegetables and fruits. There is a lot of proteins given by paneer or chicken or eggs, and then carbohydrates, especially I want people to have like complex carbohydrates, not those simple sugars. Yeah. So you should have a balanced meal, and you should have little extra. So as I told you, 300 calories is just made by one healthy snack, one glass of milk, and then one handful of nuts. So this will compensate for it. So whatever you eat regularly, that as well as little extra of these is enough.
But today we live in the Insta era, doctor. Say avoid certain fruits, avoid certain vegetables. Is avoiding like fruits like papaya and pineapple, is it good? Or is it true that we have to avoid them?
So this is the biggest myth that they tell, that, okay, don't eat papaya during pregnancy, don't eat pineapple during pregnancy. So this is not true at all. Ripe papaya is a very good fruit. It has a lot of vitamin A, it has fiber in it, and it relieves a patient of constipation, especially during pregnancy. There are a lot of constipation, isn't it? So having papaya will relieve them of constipation. So ripe papaya is very good during pregnancy, but raw papaya, unripe papaya, has some latex and papain in it, which has a little bit of abortifacient factors. So it is better to avoid unripe papaya during pregnancy. And by mistake, if you have 1 or 2 pieces of unripe papaya, it's really not going to cause any problem with your pregnancy. And then coming to pineapple has an enzyme which can cause softening of the cervix, so which can help in laboring. So but if you have to have a significant amount of that enzyme through pineapple, you'll have to eat a truckload of pineapple to cause that, which no one is going to do that. So if you like pineapple during pregnancy, having 1 or 2 slices of pineapple is really not going to matter.
And now drinking saffron, they say, gives birth, you give birth to fair complexioned babies. Is that true, doctor?
Biggest myth. Saffron or any food will not change the color of the baby or the complexion of the baby, because it is predetermined by the genetics, what the baby has got. Okay. So, but saffron can cause a little bit of mood elevation and help in aid in digestion. But mind you that more than 5 grams of saffron has abortifacient factors. So it is better not to have too much of saffron. So as a practical advice, I would tell, have 1 or 2 strands of saffron. That should be fine.
So like even in the later phase of the pregnancy, not more than 5 strands?
Better.
Okay. And another one, doctor, like what we see these days is when they get pregnant, is climbing up the stairs, okay, come and bending and doing work. Is that all fine? They say, when you bend down, it leads to abortion and things like that.
No, ma, that's biggest myth. In fact, I really recommend patients to have have good amount of physical activity throughout pregnancy if they are not high risk. High risk in the sense, if they have like a short cervix, where we tell them to be completely in bed rest and all that. Other than that, if you are carrying a healthy pregnancy, you should have 30 minutes of moderate exercises at least 5 times a week. This is the recommendation what we do. So moderate exercises can be swimming, can be walking, can be yoga also, but yoga under the guidance of a yoga practitioner, that would be fine. So they have to do exercises. And taking stairs is always fine, as if at all you are carrying a healthy pregnancy.
And also they say, like we can determine the sex of the baby by looking at their stomach. Like, if it's a pear shaped or an oval shaped. How true is that, doctor?
It is not at all true. The shape of the abdomen is determined by the fat in the abdomen and the abdominal muscle tone which the person has, not at all by the gender.
Nothing
of the
to do
patient.
with the shape of the tummy and all. Okay, right. And doctor, during pregnancies, they have these non-food cravings. For instance, like chalk powder or tooth powder and so many other things, such cravings. They say so it's something like that shows that they have some nutrition deficiency in that. Is that true, doctor?
Yeah, to an extent, yes. If they are having non-food cravings, it's better they might be having anemia and they have to get themselves checked. Because people will have craving to eat mud. And that could be mainly because of iron deficiency anemia. And then if they eat mud, right, there are a lot of spores in that can lead to worm infestation. And again, further increase anemia which the patient is having. So they have to get themselves checked if they are feeling like having those kind of things.
And what is the best sleeping position, doctor? Some advise them to sleep straight and not to sleep straight, and some say you have to sleep sidewards. Which is the best sleeping position for them?
See, sleeping position is whichever is comfortable to the patient. That is the best sleeping position which she can have. Yeah. But scientifically speaking, in the first trimester, there is nothing like sleeping this side, that side will help. Straight is also okay. And face down, let them avoid. But from the second trimester onwards, we tell them avoid sleeping straight, because by second trimester, the uterus becomes so big such that it can press on the aorta. Aorta is a great vessel which will supply the blood supply to the uterus. So as the uterus comes up, and then if you sleep straight, it can give pressure on the great vessel and reduce the blood supply to the uterus. So that's why we tell them stop sleeping straight once you are in the second trimester. But then for some time, if they sleep straight, it's really not going to have effect. Right. And then from right side or left side is better than the right side because it helps in improving the blood supply to the growing baby. But then practically speaking, no person can sleep left all the time.
Right.
So if they sleep right time, nothing is right side, nothing is going to happen. So practically what I would tell is, if you're in second and third trimester, sleep on sides. It's better for you. Straight, avoid. But sometimes if you want to sleep straight, it's still okay. It's really not going to affect your
Anything
baby.
minimal is always fine.
Yes.
And what would you advise for kids? Like, for instance, now when they have cravings, doctor, they eat a lot of junk. They say those, even the burgers or pizzas and all. How good is that?
Usually women are very conscious about their weight and complexion and all that. Normally, everyone. But during pregnancy, they give themselves license to eat anything they want, telling that, okay, it is a pregnancy craving and I can eat anything I want. During pregnancy, first, there is altered taste in the mouth. The taste buds are gone and they have altered taste in the mouth. So they feel like eating something spicy and all that. So that's still okay. But then when you're having cravings also, you should try to eat healthy food. Okay, so you feel like eating spicy, you can have you can have a salad which you have some chaat masala and all that. I mean, that is always going to suffice your craving. You feel like eating sweet, you can eat sweet to an extent, but then you can always suffice it with eating a mango or a sapota, which is actually a sweet fruit and all that, isn't it? So having a lot of junk food is really not going to help your baby or as well as you, because it leads to unnecessary weight gain. They're all empty calories, and unnecessary weight gain can lead to gestational diabetes and so on and so forth. So it's always better to eat healthy food during pregnancy. Even though you are having cravings, try to make it a healthy craving.
And I've also heard that eating spicy food, doctor, your baby will be dark, born dark. Is that true?
No, not at all. Eating spicy food can cause a lot of gastritis for you. Okay. It doesn't make the baby dark because the gut is very sensitive during pregnancy. So even a little bit of spice can cause a lot of gastritis for you. And then the thing is the sphincters. That is, there is a sphincter, or there is a band from the food pipe to the stomach, which is relaxed during pregnancy. So even they eat a little bit of spice, it causes a lot of acidity, and that acid can reflux very easily to the food pipe. So they'll have a lot of heartburn. So it's better that they avoid spicy food during pregnancy because it can cause a lot of heartburn to them.
And we've also seen that, doctor, a couple, especially in the first trimester, there is a little bit of bleeding which happens. Now, is that normal, or do they have to be cautious about this?
They have to be cautious about it because bleeding during first trimester is not good. It is a red flag. You need to reach out to your obs-gynae to see whether it is normal or not, because sometimes it could be a sign of miscarriage. Bleeding during pregnancy is not normal. It's a red flag. You need to reach out to your obstetrician to see how the baby is doing. Okay, it could be a sign of miscarriage as well. But it's not that every bleeding will cause miscarriage. So when you go to your doctor, they will check how the baby is doing and then probably put you on some extra progesterones and all that to protect the pregnancy.
As you were telling, doctor, most of your patients are from the IT field. So maybe most of them undergo these IVF treatments and things like that. But a lot of myths surrounding IVF also.
Definitely.
First thing is, like IVF people can't have a normal delivery. Is that true?
No, not at all. Even if they have an IVF pregnancy, they can have a normal delivery. The decision of delivering the patient normally or going for cesarean depends upon the obstetric complication. That means during pregnancy, whether they have diabetes, whether they have sugar, whether they have increased blood pressure, or whether the baby is too big, or whether they are carrying twins. These are the things which is going to determine us whether we have to deliver the patient normally or not. Not the how they have conceived, like with IVF or
okay.
normally.
So what are the parameters to consider for C-section? Because, nowadays we see that, like they see someday and they just get it done. But I've heard normal delivery kids they have a better immunity compared to C-section kids. Now, is that true, doctor? Like, what are the parameters to consider C-section?
See, there are a lot of obstetric parameters where we consider, thumb rule, always normal delivery is better than C-section. Whatever God has made is always better than what has man made. Man-made is the second best. So cesarean is not bad after all. Okay. When normal delivery is going to affect either the mother or the baby, then you really have to go for cesarean section. And then coming to the immunity of the children, yes, what studies have told is the normal delivery children have a better immunity compared to the cesarean children, because during normal delivery, the baby comes through the birth canal, and birth canal has a lot of microbes, and then that will populate the nose and mouth of the baby. So they develop immunity. They have a better immunity. They have lesser chance of asthma, allergies. And cesarean children, since they come out through a sterile environment, they lack that. But eventually, by getting exposed to everything, they will also develop the immunity. It's not that after all, but vis-a-vis, if you compare, yes, the chance of allergy and all that is slightly increased in cesarean children when compared to the children born through normal delivery.
We've also heard about IVF, like if you have an IVF, you will always have twins. Is that true, doctor?
It's not true at all. It depends upon the number of embryos the lady has got transferred. Usually, we do a double embryo transfer, because even if one doesn't grow, at least one more grows. So that is the whole concept of transferring two. But in the happy situation, both grow, and then that will result in twins. But if the woman tells no, if she wants to have a single baby, she can always opt for a single embryo transfer.
Okay. So basically, there's no much of a difference between normal and IVF, just that the pregnancy phase remains the same.
Pregnancy phase remains the same.
It does not differentiate between the normal one and
normal one and the cesarean. No.
Yeah. And is pregnancy only a very happy and a glowy phase? Do they have is it normal to have depression and anxiety and all that, doctor?
Definitely, isn't it? During first trimester, they're not able to eat properly. They are always nauseous. Whatever food they could eat before, that everything feels bad during pregnancy. So they get very frustrated, and some people are continuously vomiting. They are not able to eat anything. So obviously they get depressed. They get frustrated with what is happening with them. And now with being nuclear families, everyone are just working, and only husband, wife, and husband goes to work, and only the woman is stuck in the home. Always. So she has no one to share her feelings with. So naturally she feels frustrated. She feels sometimes depressed as well. But we have to see where this frustration is entering depression. So that it is a very fine line that has to be taken care of.
Yeah. Generally, when we are normal, we feel like drinking a cup of coffee or tea. But pregnancy, they say it's a strict no, considering the fact that, they feel the baby's birth weight will be less. Now, how true is this one, doctor?
200 milligrams of caffeine intake per day is okay. It is allowed during pregnancy. But anything more than 200 grams is not good. So if I have to tell you 1 cup of coffee per day by a pregnant woman is safe for the pregnancy. No, if you really like your coffee, please have your coffee 1 cup a day.
Yeah. So it's normal. It's fine to drink.
It's fine.
That will not reflect on the baby's birth weight.
No, not at all.
And post-delivery, doctor, that is, I think, quite a little complicated that way. Many of them, doctors say eat everything. At home, you're not allowed to eat anything. There is a kind of food restriction, diet that we have to follow.
Yes.
Now, is drinking water good enough during this time?
See, I have patients, okay, they come back to me where while discharging the patient from the hospital only, I tell them, there is no restriction of food from my side. Please eat everything and all that. And then after like 5 days, patient comes back and tells that she doesn't come with her. She comes back and she tells that, ma'am, they are not allowing me to eat anything at home. And I tell them that doctor has asked me to eat everything and then they're not allowing me to eat anything at home. What doctor knows? This is what the tradition is. Don't eat. That's what they tell. But then I would want to tell, please eat everything in postpartum. It's not going, in fact, it will help in milk production and all that. Okay. And about the water intake during postpartum, very important. The patient has to drink about 2.5 liters of water every day during postpartum, because she is losing water everywhere. See, she is bleeding, she's losing water. She is breastfeeding, she's losing water. She's sweating so much, she's losing water. And along with that, she's not being given enough water, she will get dehydrated. Along with that, there is the hypercoagulability of the blood. What do you mean by hypercoagulability? The blood is thickened. It clots very fast during postpartum. That is the nature's mechanism, protective mechanism for us. In such a condition, if you dehydrate her also, the blood will clot very easily. And then we have lost patients because of this myth, where the patient was not given water. And another thing is, you should not move postpartum. You should take complete rest. You should not move.
Yeah.
And not moving also, it is a very nice environment where blood can clot.
Okay.
Blood is static. Blood is dehydrated, blood is already thick, the blood clots, and the women have ended up with deep vein thrombosis, some cortical vein thrombosis, and patients have died.
But generally they say, so after C-section, you're supposed to take adequate rest, not get up and move too much. That is what I've also heard, doctor.
See, that was the traditional thing. This newer studies tell that the earlier the patient moves, the better is her recovery. Okay. The earlier she moves, lesser is her chance of deep vein thrombosis and better is her recovery. Yes, they'll have pain, but see, they have this thing that, okay, if I move, the inside stitches will open.
Right. Yeah.
The stitches will. So that's not true at all. Please, as soon as you feel fine, because you are covered with painkillers and all that, please get up, please move. Okay, it's always healthy for you and for the baby and for the healing as well.
So faster the better. Then.
Yes, the faster mobility is always the better.
And doctor, what about lactation? Because, initially you may not have sufficient milk. How do we increase lactation? And how do we know the baby is full?
Okay. See, initially once the woman is delivered, right, it takes some time for the milk to get secreted. The first milk which comes is colostrum. Some women get it faster and they're able to feed the baby. Some women take some time to start lactating. The cardinal rule of getting enough milk is feeding frequently. The more frequent you feed the baby, the more fast, right. I mean, the many times you feed the baby, the more milk you're going to get, because the milk production in our body is determined by a hormone called as prolactin, which is secreted from the brain. And brain will, as much as the baby sucks the breast, the brain will understand that, okay, milk production has to be increased. So it will increase the prolactin hormone level in our body, and that's how the milk secretion happens. Okay. If you don't feed the baby for more amount of time, like 3 hours, 4 hours, if you don't feed the baby, the brain will understand that, okay, so much milk is not required. So it will reduce the prolactin secretion. Right. So that's why increase the frequency. If at all you want to increase the milk supply, please have a balanced diet. Increase the water intake and increase the number of times you are feeding the baby. Then the milk secretion increases automatically.
So what is the frequency that we have to follow, doctor?
You can feed every 2 hours, you can feed the baby, or on demand. Okay. So if the baby is asking for feed, even before 2 hours, please feed the baby.
Okay.
Or at least once in 2 hours, feed the baby.
It's normal to drink, for the baby to drink even with an interval of 1.5 hours, also fine.
Yes, because the baby's stomach capacity is very less. So once it takes it cannot take so much amount of milk at one go. Okay. So it gets emptied faster. And besides, the mother's milk is easily digestible for the baby. So it gets digested easily and they are hungry again. Okay. Unlike formula is not very easily digestible. It's staying in the stomach for quite a long time. So baby feels full for a long time, and which is not normal, right?
Yes. But generally what they feel is, doctor, because they drink frequently, they feel their milk is not sufficient and they start going for formula milk. Yes. Now, how good is that?
See, if at all you're not having enough milk, like, the baby's weight is reducing, the baby is getting dehydrated, please take formula milk. But if you're having enough milk, but just that you are feeling that
Right.
you're not having enough, please don't do that. Feed the baby. How many ever times the baby asks for feed, please give the baby. And if the baby sucks on your breast and sleeps, that means it's getting enough milk.
Yeah.
If it is passing a urine for about like 7-8 times in the day, then it is getting enough milk. And if the weight gain of the baby is happening as per what your pediatrician is telling, then it is getting enough milk. So you need not take formula.
Yes. And now today we live in this Google era, doctor. How dangerous is scrolling? Continuously scrolling for tips and pregnancy tips and all that. I mean, do you also encounter such patients?
Most of the times my patients come like that only. They go through the Google tips and they get confused and they come just to clarify things from me. Okay. So what I would tell is, yes, you go through the Google, you take the tips, but always talk it out with your doctor and see if it is right for you, because that is a mass information. It might not be curated for you.
Right.
Isn't it? So, I mean, they tell, okay, eating mango is good during pregnancy, eating fruits is good during pregnancy. But if you are diabetic, you take mango, it's not good, isn't it? So, that way your doctor will curate the information for you, and then they would tell you. So, they tell exercise is good during pregnancy, okay? But then if you're having a short cervix, if you're having a low placenta, obviously you should not be lifting weights, you should not be like so physically active. So, the doctor will curate the information for you.
And you see patients on a daily basis, doctor.
Yeah.
Do you recall any kind of a hilarious kind? Of course, as a doctor, maybe it might not sound hilarious, but something which you feel was totally out of the box kind of a question for you.
This happened, Archana. This happened like about 20 years back when I was just starting out. And that 20 years back, you know, right? There was not much of mobile and all that. And it was those times where you should not take a photo of a woman. I mean, it leads to a lot of what do you call that, bad omen and all those things. So that way, one person had asked me, can I take a photo of my wife?
Okay.
Then I was like, yeah, your wife, you take her photo. What is wrong? No, he was like, does this race affect the baby and all that? So that was one funny thing which I felt. But then see, it might not be funny for him because it was his real doubt. But then at that time it felt
right.
But now it is now no one have that doubt, because now they are getting the pregnancy photo shoots.
Yeah, baby
Pregnancy
shoots.
photo shoots done.
And plus they always have the mobile in hand, and they're always, even the moms, to-be moms are always scrolling. And is it really harmful, doctor, those kind of rays? Because they have also heard, like switching off TV, when you're not, nowadays the TV screens are also quite big. If you're somewhere close by, switching off and switching on the TV, the rays might affect the baby. Is that true?
No, I don't think so. That because whatever gadgets, everything comes out, it will be that electromagnetic radiation will be kept in the acceptable limits, isn't it?
Doctor, morning sickness is very common among the first trimester. Now, does it continue till all the 9 months, or is it only for the first trimester?
No, not at all. Some people have evening sickness also. Some people start feeling all those symptoms in the evening. So this nausea, vomiting, tiredness, feeling like bloated, bitter taste in the mouth, all these things constitute this morning sickness. So for some people, it will be just that little bloating. For some people, they go on vomiting. It can be any of this spectrum. And most of them, it settles down in the first trimester. But for some people, it can, very less people, it can continue till 9 months as well.
So morning sickness is not confined to mornings. It's generally overall.
It can go to evenings as well.
Okay. And one more, doctor. Now, of course, there is this baby mooning happening. Otherwise, they say you're not supposed to travel and all for a longer distance. Is that true?
In first trimester, I would encourage patients not to travel, not because that it can cause abortion, because they have a lot of nausea, vomiting and all that, and travel can aggravate it, and it can trigger off like too much of vomiting, especially change in the place again can cause the loose motion, some infection. So that's why in the first trimester, we are not supposed to give many medicines as well. So which is why I tell them to stick to one place, don't travel too much and all that. Okay. That is over long distance, strenuous travels. I ask them not to do that. But second trimester, if at all you really have to travel, second trimester is the best time to travel during pregnancy. Okay. Again, in third trimester, after 32 weeks, I ask them always be in the place where you plan to deliver, because any emergencies, anything can happen. So it's always better to be in the place where you plan to deliver, so that everything is planned and all that. And about the mode of travel, all modes of travel are safe during pregnancy, even air travel. But in air travel, especially first trimester, if it is if they are frequent flyers, they tell some cosmic radiations can affect and all that. But like one-time travel usually doesn't matter. But what are the precautions you have to take when you're doing air travel, especially long distance air travel where you're cramped and then not mobile and all that? During pregnancy, the blood easily clots. So that's why the blood can, if you are keeping your leg not moving mobile at all for a long period of time, blood can clot in the leg. So to avoid that, if at all you are thinking that you are traveling for a long distance and all that, it's always better to wear something called as DVT stockings and wear comfortable clothes. And if at all there is place to walk around when you're traveling, please walk around. If it is an plane, then I would ask you to take a seat where you can walk. If at all it is, I would tell them do a train travel. It is better that you can go past urine and all that, it is frequent. And then if at all you are doing a long distance car travel, it is better to stop the car every 2 hours, allow the woman to walk around and then again start the journey.
So being mobile is important, like
It's
practically
important,
not stationary. Sitting in a place is not advisable during pregnancy.
No.
Yeah, okay, doctor. So finally, what would your advice to be like for the to-be moms who are already pregnant and the postpartum phase, whatever? What would your advice be to such women?
I tell, see, this pregnancy is the biggest gift which the nature has bestowed upon us. So we should be very happy that we are carrying pregnancy and we are able to give birth to a new life. And you should enjoy that particular phase, and you should not like over romanticize pregnancy also, because we all have been getting, as soon as you're born a woman, you know that someday you're going to get pregnant and you're going to deliver. So isn't it? We are mentally prepared from before. So it is a very natural thing. Don't make it a very clinical thing that, okay, you should not sit, you should do that and all that. It's a very natural thing. Please take it naturally. Enjoy it. Eat healthy food. Exercise. Walk around. Be happy, and you will give birth to very happy kids.
Okay. Thank you, doctor. It was very insightful talking to you. Thank you so much for being on the show.
Same here. Thank you.
I hope we've cleared many of your doubts today. During your pregnancy, in case you have some doubts, do contact your gynecologist and not the internet. For more such content, keep watching NewsFirst Prime.